Defibrillation is the process of restarting an erratic heart. Natural electrical impulses control your heartbeat. When these impulses fail, the heart beats erratically and no longer pumps blood. This is called fibrillation or twitching. Defibrillation administers a shock that momentarily disrupts the erratic signals and allows the normal heartbeat to return. As time passes, the probability of defibrillation restoring the heartbeat goes down. Automated external defibrillators, or AEDs. With AEDs, you no longer have to wait for emergency medical services personnel to defibrillate a patient's heart. An AED is a portable machine that automatically delivers a shock to a patient who is not breathing normally and whose heart has stopped beating or is beating irregularly. All AEDs function in the same basic way. First, you turn the AED on by either opening the unit or pushing the appropriate button. Next, connect the AED to a patient via 2 chest pads. When the AED is turned on, its computer analyzes the patient's need for a shock. If the AED detects a heart rhythm in need of a shock, the machine will indicate that a shock is advised. To effectively treat heart fibrillation, you must be able to rapidly integrate CPR with the use of an AED. To give a patient the best chance of survival, 3 actions must occur within the first moments of a cardiac arrest. First, activate the emergency medical services system. Second, provide immediate CPR. And third, use an AED. If a bystander is available while you provide the patient with CPR, have them call emergency medical services and retrieve an AED. Further, bystanders can set up the AED and apply the chest pads while you continue CPR. Overall, both of these bystander actions allow you to minimize interruptions in CPR.
Opening the lid will turn on the power for some AEDs. With others, simply press the power button. This starts voice instructions and readies the device for use.
Apply pads to patient's bare chest.
Pads must be applied to a bare chest. Locate and pull out the defibrillation pads. The pads have pictures on them to show proper placement. Proper placement will assure that the pads are able to direct the electrical shock through the heart. Peel the pads from the backing sheet one at a time and place them as shown in the pictures. Place one pad below the right collarbone, above the nipple, and beside the breastbone. Make sure it adheres well by pressing it flat. Place the other pad lower on the left side, over the ribs, and a few inches below the armpit. Again, press firmly.
Stay clear of patient. Analyzing.
An AED automatically starts analyzing once the pads are in place. Stop CPR. Movement can interrupt the analysis. Be certain that no one is touching the person.
Shock advised.
If defibrillation is advised, the AED will begin to charge for shock delivery. Quickly look to make sure no one is in contact with the person before delivering the shock.
Now, shock delivered.
Once delivered, immediately resume CPR, starting with